Type 2 diabetes is a chronic condition that affects millions of people worldwide, characterized by high blood sugar levels due to insulin resistance and a relative lack of insulin production by the pancreas. It develops gradually over several years, making early detection crucial to prevent serious long-term complications like heart disease, kidney damage, and vision loss. Early detection is essential because some symptoms can be subtle and easily mistaken for other common conditions, yet recognizing them promptly can lead to timely intervention and better health outcomes. In this video, we will explore 5 early symptoms of type 2 diabetes that are often overlooked or misattributed to everyday issues. Type 2 diabetes develops gradually as the body becomes resistant to insulin, a vital hormone produced by the pancreas that helps glucose from food enter the cells to be used as energy. When cells don't respond properly to insulin, glucose accumulates in the bloodstream, resulting in hyperglycemia, and over time, the pancreas may struggle to produce enough insulin to compensate for this resistance. As a result, when cells fail to absorb glucose effectively due to insulin resistance, the excess glucose builds up in the blood, leading to hyperglycemia, which can damage organs and tissues if left unchecked. Our first symptom is frequent urination, known medically as polyuria, which happens when elevated blood sugar levels overwhelm the kidney's ability to filter and reabsorb glucose. The kidneys work overtime to filter out the excess glucose from the blood, but since they can't reabsorb at all, it spills into the urine, drawing additional water along with it, and thereby increasing the volume and frequency of urination. This frequent urination can often be confused with a urinary tract infection, an overactive bladder, pregnancy-related changes, or simply the result of consuming too many fluids, especially caffeinated or alcoholic beverages. And it can also be a side effect of certain medications like diuretics. Next, increased thirst or polydipsia frequently accompanies frequent urination as the body loses fluids rapidly and becomes dehydrated in the process. To compensate for the fluids lost through excessive urination, the body's thirst mechanism is triggered, prompting a strong urge to drink more water and replace the depleted hydration levels. This heightened thirst is commonly mistaken for simple dehydration following physical exercise or after consuming salty foods that increase fluid needs, and it can also stem from rarer conditions like diabetes insipidus, certain medications, pregnancy, or even mental health issues. The third symptom is unexplained weight loss, which occurs even when a person maintains a normal or increased appetite, signaling that something is disrupting normal energy use in the body. Because the body cannot utilize glucose effectively for energy due to insulin resistance, it begins to break down muscle tissue and fat stores as alternative fuel sources, and additionally, the calories are lost through the excess glucose excreted in urine during frequent urination. Such weight loss might be attributed to everyday factors like stress, sudden changes in diet or exercise routines, or more serious underlying conditions including hyperthyroidism, cancer, or inflammatory diseases like Crohn's. And it's typically considered significant if it involves losing 10 pounds or 5% of body weight over 6 to 12 months, sometimes as a side effect of medications. Our fourth symptom is fatigue, which manifests as a persistent and often debilitating sense of tiredness and exhaustion that interferes with daily activities. Elevated blood sugar prevents the body's cells from receiving adequate glucose for energy production, resulting in this widespread feeling of low energy, and fluctuations in blood sugar levels can further exacerbate the exhaustion. Fatigue is a very nonspecific symptom that can arise from numerous causes, such as ongoing stress, insufficient sleep, anemia, depression, various other medical conditions, or even as a side effect of certain medications. Finally, blurred vision represents another key early symptom of type 2 diabetes that warrants attention. High blood sugar causes the lens of the eye to swell due to shifts in fluid levels, temporarily altering its shape and impairing the eye's ability to focus clearly, which can affect both near and far vision. This blurring is frequently mistaken for common issues like eye strain from prolonged screen time, dry eyes, other ocular conditions, or simply the need for an updated glasses prescription, and it might also be a temporary effect from certain medications. Identifying these 5 early symptoms, frequent urination, increased thirst, unexplained weight loss, fatigue, and blurred vision, early on can facilitate a quicker diagnosis and more effective treatment plan. Early intervention, including lifestyle modifications like balanced diet and regular exercise, along with appropriate medical treatments, can dramatically lower the risks of severe long-term complications such as cardiovascular disease, stroke, kidney failure, and progressive vision impairment. If you're experiencing any combination of these symptoms, particularly alongside risk factors like being overweight, having a family history of diabetes, or leading a sedentary lifestyle, it's important to consult a healthcare professional promptly for a thorough evaluation. A straightforward blood test, such as fasting blood glucose or A1C, can confirm whether diabetes is present, empowering you to take proactive steps toward effectively managing your health and preventing further issues.